Hello everyone. This is Dr. Wang again from TCM Center International.
Hello.
And today we are going to talk about coronavirus. This is a big surprise. In fact, everyone today is talking about coronavirus, right?
Yes.
So,
Because media propaganda.
media
So much.
there is a so
They
do you
only
think
report about this, nothing else.
nothing else? So we only hear about coronavirus these days. Um I was thinking about the beginning of this virus and the reasons why all this outbreak occurred. But I don't think it would be very easy to find the main reason for this. What is your opinion, Dr. Wang?
You mean the reason? So many ideas about the reason. Some I think is natural from rat or bat. Some I think from a laboratory, not careful, suddenly caught some virus to go outside. Suddenly it's becoming infectious. So it's a modified virus. Anyway, some I think is 5G or radiation or stress, immunity weak. Especially some old men, because some old men or advanced industry zone just happened. More people illness or death.
So, do you think where with the with lower quality of the air, there is more possibility to have this kind of problems with coronavirus?
Anyway, it's also one factor. I think.
Okay.
But not the most important factor. By traditional Chinese medicine, the cause of any disease, including infectious disease, can contain two factors. One is the inner factor. It's called seven emotion. It means stress, panic, or how to say, not good rest, overtired, or chronic fatigue syndrome. This kind of people easy to be infected. So another factor is that's the weather. Every 60 years, the rat year of Chinese year, come. So this is why they said because of rat, because of bat. Even they think a bat and a rat they are the same species.
In China, do they consider similar species?
Yes.
Yes, they are. So, I even heard the opinion, and this is only something in between, that because it's the rat year in Chinese lunar calendar, so we are supposed to be hidden like rats in the holes. So maybe we are really now behaving like rats.
Yeah, we have to learn something from rat.
From rats,
That's a hide. Hide in the earth.
Yes.
Or at home. So in that way, we can preserve our image.
Okay.
And maybe more contact with the family members, and more patience, and more peace, and more love.
Okay, so anyway, these are the good side of the situation. Yeah. But what I wanted to ask, I understood that you said that the more stress we have, the more stressful the situation is, it's easier to be infected by any virus. Is that so?
Yes, sure. This panic is the most stress. Number one stress is panic. Yeah. So this is why we have to prevent any panic. Just be patient and peaceful.
Okay.
And pray.
So, would it be fair to say that fear and panic that we, how to say, see and hear every day from TV, from internet, from newspaper, that fear and panic is not good for our immunity.
Sure, not good. So we should not be influenced by any medium. It will make you worried and panic. Right?
Yeah. And are you aware about this media? Is it all that we see in media? Uh, should we trust everything we see in media?
And basically look like there's some truth, but we live in the truth and lie. That's the truth. Even the word is not truth. Some I think by Buddhists.
Okay, so let's go back to the virus. This is very interesting virus because, as far as we know, it exists for and it's known for a very, very long time. It was always part of a flu infection. And now this coronavirus suddenly became so dangerous. Is it possible for a virus to become dangerous naturally? So after so many years to be present in our environment, and suddenly it's so dangerous. Is it possible to virus to become naturally dangerous, or it should be modificated in some laboratory? Well, what do you think?
By natural virus, I think should not be too dangerous. So because of the SARS also virus, they think it's dangerous, but in fact it's not so dangerous. Even this time the coronavirus even less how to say poisoning, less death mortality or death rate. So that means this time is not as severe as SARS, but the propaganda look like reports only only about this coronavirus, so make people more panic.
So in fact, it's about marketing. This virus has the best marketing ever. Do you think so?
Yeah, advertising or,
yes.
Or how to say focus.
Yes.
Become a focus.
Yes. Okay. So um, let me ask you something about, well, if anyway there is some coronavirus, whether it's dangerous or not, but what would be the best way to defend? What we should do? What we should think? Should we, I don't know, pray? What should we do to defend?
In my opinion, just normal living. And be careful, but not panic. It's not necessary at all. If more panic, more worse immunity, more infectious. If if they are wrong, really some so many viruses.
What else?
Normal it means good sleep, relax, be happy. The normal living. We have to eat something, not so greasy food. For example, more vegetable, more vitamin C, make immunity better. Drink green tea or any kind of tea, clean the liver, make immunity better. Most important, optimistic.
Optimistic.
Don't worry, be happy. And some food with pumpkin soup, or someone want to bake some pumpkin to eat. Also good for immunity. So many things. Almost normal.
So we are being advised, which is okay, to wash our hands which is normal. But what I have heard, some people are washing their hands so much so they really scrub out the
The skin.
the skin.
Oh,
Yes.
too much.
So
That means a panic, really
this
panic.
is really panic.
Yeah.
But what comes
Not
to my
necessary.
mind is not only that it's not necessary, but
Yeah.
there is even more possibility for infection.
For buffering, for our immunity. First part is I think skin. Second, for example, is tonsil. Third portal is lung. Any disease, anything happen, usually cough is the first reaction. In fact, the cough is not only bad. Cough make the toxin go out, so make immunity better. But if someone cough or sneeze too much, maybe disturb other, you have to make wear the mask. But some other, if no cough, no nothing special, you don't need the mask. Even the mask is not absolute prevent from a virus, I think.
Okay.
Yeah, only from one side, from outside. Most important, the immunity, the blood clean the blood, good sleep, good nutrition, good sunlight. Even sunlight is necessary. You don't need to stay at home. Only you don't go outside even don't go to the balcony to enjoy the sunshine. Someone singing. Last night I heard some neighbor singing. Very beautiful song. I think that's good. So especially some young men or girls. They don't care so much. That means they have more consciousness.
Yeah, it was organized singing in Croatia yesterday. I heard. Anyway, what I wanted to ask, and I think this will be very interesting for everyone to hear. If you have a patient with coronavirus and it comes for your treatment, which is basically Chinese medicine, manual Chinese medicine, tuina, cupping, acupuncture, reflexology. What would you do? And can you advise people to do something at home to help themselves to open maybe
This
this
is a good
or
idea.
something? Okay.
Yeah. Can do some massage.
Okay.
Self-massage on the nose, on the head, on the neck, or beating the chest. Do some breathing, deep breathing, qigong or tai chi in the balcony or on the street.
What would be the most important?
In the park.
What would be the most important thing to do for people who cannot breathe because of this virus?
If you cannot breathe, immediately give emergency for first aid. First, pressure the chest, press the chest, suddenly breathing, press the chest, breathing. This is for emergency even, can save the life. So when they are breathing better and cough better, so secretion come out. Later they just recover. They don't need any medicine or any injection.
Anyway, we cannot say maybe they will need some medicine.
But some if they want to use medicine, it's okay. It's your choice.
Yes.
But in my opinion, I don't need.
So the most important thing in fact would be to open the chest cavity to make it more flexible.
Or you just hitting your scapula on the tree in the park. Hitting on the wall, for example, on the wall. Make the heart better, make the lung better. It's very simple.
But I guess it will sound
and breathing. Deepest breathing and tremor until tremor. That's good. So many methods, and you can beat yourself different, heart meridian, this mericardial meridian, pericardial meridian. or gallbladder meridian, for heart, for lung, so many things.
So
do cupping, make the bubble come out. Some dark blood come out. Mucus come out. Later immunity much better. So later breathing better, circulation better, immunity better. Very easy. So I tell some patients do at home, cupping therapy.
So what I wanted to say is that this can sound very reasonable for people who are already in alternative medicine because we know how effective it is. And I remember that you saved the person, an old man from even, it was he was really having some attack and he really needed some massage on his back. So he fainted. It was in a bad situation, and I know how
this for heart attack also effective.
I know how this alternative medicine is effective, and how strong how good effect it can have on even very severe diseases. But anyway, I think some of our listeners, some of our audience will think that maybe this is not enough. Maybe they need some other medicine. And we can say it's also okay.
The simpler the better.
The simpler the better.
In fact, it's very simple.
Do you think
very effective.
Our bodies have a natural way to regulate themselves?
Yeah, that's the most important.
And we only have to give them a little push.
We help the body rect, open the chest, make the spine open, make the spine more elastic. So move the neck, good for heart and lung.
Yes, I'm thinking about the panic amongst the people. I think that many are scared today. Because many people think if they go out, they can endanger others, or others can endanger them. And we already live in a kind of psychosis right now. Many people are there. So, do you have something to tell them? Do you have any message for those people? Just let them feel easier because of the situation. What would be your advice?
I think I found I go to buy bread. Also found in the shop. They just one by one go to the shop. Look like a very standard, very
accustomed to it.
Very careful.
Careful.
Yeah. So some most wear mask.
Did you?
I wear a mask just to show. I want to protect others. Didn't mean that I'm afraid of other, to be infected to me. So in fact, before I go to this morning, I forgot to bring the mask. So so later I think maybe I have to bring this mask. That means this is not for me. It's not my regulation, So, but I think for others, I have to wear the mask.
Do you think they will be even more scared because you're Chinese?
No one cares. No one cares.
Okay, so what would be your message for those people? About the panic, about the fear, about the terror. They really feel the terror.
I think anyway, someone if want to wear mask, it's their choice. They can wear. They feel more safe. Maybe they feel protect themselves and protect others. More responsible for himself and for others.
Okay.
That's okay. It's not so difficult, and it's not so expensive even. So it's okay. But someone look like standing 1 meter, 2 meter, I think is too far. Look like you are always afraid of other people. Even they wear a mask, you are afraid of others. So why you are not afraid of your wife or your husband or your children or your parents? So that means the love look like not really look like selfish. This is not look like for others. Look like most for self, for himself.
Okay. So, is it fair to say that all of us live through this situation in a different way? We all feel and think and perceive this situation
Yeah.
in the way we are. And
Sure.
is it fair to say that whatever someone thinks it's true, it's really true and it's their own reality? Even the people who are afraid, so very much afraid, we think it's not. We think it's not necessary, but they're so afraid that they have their own reality, and they live in that reality. But what do you think about the difference between that reality and reality that we don't have to be afraid? What is the difference?
There's a limitation, Some are careful. Some are even no virus. They always panic, because stress, because we weak energy, because blockage, because maybe DNA is genetic. Sometimes from parents, from childhood. This is not easy to change. So suddenly this happened. There are more panic than normal people, than most people. So I think just be normal living. Yeah.
But yeah, so you think that
When
you said
you
one
think
word. You said one word. I just want to refer to that one. You said that people who are living in the reality of fear and panic have limitations
yeah,
according to the solution of this problem. So if we live in a fear, we live in a panic, we will wash our hands 20 times or 30 times, we will scrub out our skin, we will wear a mask, we will be afraid of everyone. So this is the way people are trying to save themselves. They want to be safe, but there is always a limitation in there. And I think there is a different kind of reality and perceiving the reality that has no limitation. And this, I think, this reality and this perception should be fearless, without fear.
Not too much.
Without panic.
Not to panic too much, or even not necessary to be panic at all.
Okay. Yeah. So, what would be your, I don't know, final advice for, and what is your prediction? Do you have any idea how this situation will develop?
This how do you think? Or this you think this reality is so severe? Maybe you always think all life is panic. All life this virus disturb you. But if you think it's nothing is serious. It's just normal.
Yeah.
So
yeah, you said something. Sorry, you said something right here. If you think it's always severe and you live in panic, there will always be
because the virus are always a virus.
There is always something that will disturb you.
Yeah.
Now it's coronavirus.
Yeah.
Tomorrow it will be some other virus, or bacteria, or some neighbor.
Yeah, even no virus is also panic.
Someone will disturb you. So I think that solution is in us, not outside.
Someone died. This is not only because of virus. Even no virus, they also died.
Yeah.
So, but someone think they just died of a virus.
Yeah.
Maybe the diagnosis is even questionable.
Yeah, this is the problem because what we witness today is that many people that have serious diseases like cancer, like brain stroke, and people who are really can be considered an old.
COPD, for example, also make someone die.
Yes.
Someone heart attack died. Yes. But when they attacked, when they give a test, maybe they found the virus. But in fact, this is not because of virus they died. It's just because they cannot breathe. They have no energy.
Yeah.
Some are maybe too old, some are too weak, some are too tired. They cannot sleep.
Yes.
So in that way, they have not good immunity, not good energy.
I just want to refer to tests. Do you think we can believe those tests 100%?
I heard some tests, some patients, even in China, even in Europe, also some test one time negative, second time also negative, third time positive. So that means this test not
Yes, that happened in Croatia.
not absolute correct.
Yes.
Someone you test is positive, but someone no attack, not infection. How to say? Not
No symptoms.
No symptom.
Yeah.
So you cannot only depend on the test. Look like someone headache, you check CT, cannot find anything. But they are low blood pressure, or maybe they are cold. Even no low blood pressure, they feel cold. So in that way, we cannot only depend on the test or any equipment.
Anyway, UK government has put this virus out of the list of very dangerous viruses. So yeah. So and in Sweden, there is much more freedom in going out than, for example, in Croatia. And so not every country reacted in the same way. But yeah, so I think it's always about people, not about the virus.
Yes, yeah, that's
it's always how people react, and the governments, and how the citizens will react. Will they be scared and panicked and all?
Very good idea.
So anyway, the final advice. Anyway, you told us already a few times what we should do. But what would be, if you can make it in one sentence, what would be your final advice for everyone in this, we can say, strange times? We've never faced something like this, that the whole world is locked up.
Oh, yeah.
Almost. Yeah. So what would be your final advice, and what would be your prediction? Do you think this pandemic, how to say, story will finish soon or later?
I think the weather change. So after this month will be over. Virus will be over.
Oh, this is very good to hear.
Yeah.
We can hope for that. Yeah.
Yeah. So, but anyway, some reporter in Italy. This is not a reporter. I found someone, in the hospital in Italy. They found it's all empty, but they said few thousand died, or 1,000 died, or at least few hundred died.
Every day.
Every day.
They say every day.
Even every day, right?
Yeah.
So, but they give a reporter gave a photo. It's even coffin. That's a photo. They have no real photo. I heard it's old picture. It's not not really picture. I cannot imagine this can happen. And another lady went to Italy to make a photo. She's not a reporter, but the hospital is empty, so no patients, even less patient than before. So if really was so severe, the patient will be even in the corridor full of patients, but no patients. So maybe most people stay at home, and not really some patients. So many people died. Some diabetes died. They said, "Oh, this is a virus." Some heart attack died. They said, "A virus."
I want to ask you something. This is interesting what you mentioned. So yeah, we saw today the corridors of completely empty hospital in Bologna, and they said it's a center of corona outbreak in northern Italy. But You were working in a hospital in Qingdao.
Yes.
And when something would happen, for example, some big, I don't know, traffic accident or many people infected or something, how was it in your hospital? Is it possible? I know China has so much people, but anyway, there are so much hospitals there. So, what was the situation when you had a big outbreak? Is it possible to have so empty hospitals?
Yeah, if more people and more hospital and more people. So if outbreak of any infectious disease or car accident, any hospital would be full of patients. Even in the corridor.
So is it possible to
temporary
have
bed?
So
impossible is empty.
It's possible,
right? If there's a virus infectious.
Yeah.
So this means
This is strange.
this lady
At least it's
very strange.
Yeah. Do you think so?
This look like hawks.
So at least we can say we don't know what is it. What is it, a hoax or what is it? But we can say that at least it's strange to see completely
very
empty hospital
Cannot
during the outbreak where almost 1,000 people a day die. Right?
So I hope the reporter give a whole picture. Not only one hospital. Maybe she should. This is not a reporter anyway. But if a real reporter, professional reporter, they should give a real picture and a real hospital and the most important hospital or area hospital.
This was
report.
I think.
Give a statistic. So.
But anyway, this lady was not about statistics. She just wanted to show.
By the way,
that there is no pressure,
no patients at all.
No patients in that hospital. Anyway. So, okay, I think we said enough. And the last sentence, do you have any idea what to say for this video? Any idea?
Just hope our audience feel happy to come down and peaceful, high consciousness. You are your owner of your health and happy life.
Okay. Okay. Thank you so much.
Thank
I hope next time we will talk about our Chinese medicine and we wouldn't be, how to say, we don't have to talk about coronavirus again.
No.
We hope it will be over.
In 1 month.
Yeah. It's over. Let's go outside. Bye-bye. See you next time.
See you.